My name is Mike Rizzi. I'm recently retired after 45 years of working in the substance use disorder treatment industry, and I think I'd like to start out with saying that as the PDMP is an excellent piece of work insofar as it enables us to understand what's happening in practices in the community. But what's also important to understand is that every prescription that is written, this is not just for opioids. This is for all prescriptions in all drug categories that get recorded and reported through the PDMP. One of the things that I believe concerns us is that if in fact a particular physician were being investigated or inquiries were designed for a particular physician around a particular medication, every patient who may have received that medication from that physician is subject to being included in the inquiry. Therefore, you don't even have to be a substance user, so to speak. You don't have to have a substance use disorder. You can be caught up in the net of the inquiry just by virtue of the fact that you were a patient of said doctor. And as Dr. Fessler mentioned, the essential element of that is that it opens up every individual's personal medicine chest to an inquiry from an outside law enforcement without a warrant. We believe that the health department has the authority to investigate any physician who has been identified as a practicer out of bounds. Having said that, the health department can initiate any investigation that it chooses on any physician, and then with findings that it arrives at, can notify law enforcement of any violations that they think are relevant and or important. So the warrantless access to individual medicine chests, private, in your home medicine chest, can be avoided if in fact we realize that the Department of Health has the capacity to do the very same investigation and has done so. We have seen over the past several years the number of opioid prescriptions significantly reduced. We also know at this point that that opioid overdoses are now being dominated by fentanyl and other drugs, not prescription medication. So any effort to connect the overdose epidemic is important, but I don't believe it's going to be resolved by the bill as stated. And as a person who's been in this business for a long time, I would suggest that it be vetoed by the governor.